More local news now. Several local healthcare providers today collectively saying their clinics are seeing more patients with flu and COVID symptoms lately, causing long wait times. They say people experiencing mild to moderate symptoms of respiratory illnesses who are in otherwise good health should stay home or seek virtual care options. Today's announcement could leave some employees in a tough spot.
At the height of the pandemic, employers had more options for giving out sick time, but as the pandemic slows down, they're left in a bit of a gray area. Braden Ross explains.
We are really getting overrun.
Today, an unusual message from Madison area hospitals asking some people not to come. In a joint statement, 5 Madison area health systems said wait times in emergency rooms and urgent cares are skyrocketing thanks to rising numbers of the flu, COVID, and RSV.
Everybody's getting, overwhelmed with these upper respiratory infections and asking people to use some maybe different thought processes on how they seek care.
They're asking people to monitor and treat their symptoms at home if they can, but this new guidance may have some employees wondering how they can prove they're sick to take time off.
Any employer who's requiring an employee to provide a doctor's note really should take stock of just how strained those resources are now.
Employment attorney Colin Good says during the peak of the pandemic, employers had more options.
What changed, though, with the pandemic is that employers had a lot more tools at their disposal when employees were off work.
Under COVID policies, employees had more leeway to stay home when they were sick. But now,
we're kind of in a hybrid space, right? The pandemic is still going on.
Good says employees should know what their employer requires and also what the law says. Dr. David Ottenbaker with SSM Health says those who need doctor's notes can also use telehealth options to avoid wait times.
If people want to be seen or if it's something as an employee kind of where they have to get a note, we have that SSM Express Virtual Care, which is, again, a nice alternative where they don't have to be seen in person.
If you're high risk, healthcare providers say you should still seek care in person. And if you're worried about work, check your rights under the Family Medical Leave Act and the Wisconsin Fair Employment Law.